Hello, thank you for stopping your lunchtime scroll to spend some time with us. My name is Amy Marlow-Macoy,
And I'm Amy Kempe. We are
and
the
we are the
co-authors.
authors of the amazing new book, The Clinician's Guide to Treating Adult Children of Narcissists.
Yes. So this is being launched today. So we're going to do a little lunchtime talk and tell you some of the key points that we think is important to understand when working with individuals who have come from narcissistic abuse.
Yeah, we're gonna give you some nuggets from our book that is years and years of experience and learning and wonderful client work that helps us give you something that we hope will benefit you. So, going through just a few of the, kind of nuggety key points in our book, we'll start with one that I hear all the time whenever I do a PESI talk or even just chatting with other therapists. Um, Narcissistic abuse is a real thing. It is not just a TikTok trend, no matter how popular it is on TikTok. Narcissistic personality types, NPD, has existed long before TikTok or any kind of social media was a thing and has been studied in the field of psychology for many decades. We can see its roots even as far back as ancient Greek mythology. And what we're doing in this book is just helping kind of condense some of that research and learning and training to talk to you about what narcissistic abuse looks like and how it actually impacts people. So,
Mm-hmm.
point number one, narcissistic abuse is a real thing. Please do not dismiss it just because it's popular on TikTok.
That's right. That's right. It kind of leads into the next point of the book. It's that it has like such far-reaching effects, and this is where we see on the social media or TikTok, kind of these like black and white blanket statements, boom, 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 and that's not really the nuance, the complexity of what we're dealing with here. So our book goes into a lot more detail, but it explains how it affects relationships. Obviously, if you're being impacted by a narcissist, it affects relationally, and that's mostly what we see on social media is the impact on relationships. But it goes deeper than that. It looks at self-esteem. It looks at your spirituality and the impact narcissistic abuse really has on identity and period. Whether that's your spirituality, your body, and your health, as well as any sort of sexual wellness. So, looking at different facets of impact is another key feature in what we're trying to help people understand.
Yeah, and again, kind of piggybacking off what Amy's saying about the complexity and the nuance of narcissistic abuse is it's not black and white. In fact, it can be very subtle. When we think about a narcissist, we tend to think of someone who's like really bombastic, really loud, really grandiose, really in your face, someone who is like absolutely obnoxious most of the time. And the reality is that a lot of narcissistic abuse can fly under the radar. It can be very subtle. It can look different depending on what type of person you have who has these narcissistic traits, how they manifest, which traits they have the most, like the highest level of versus where they are on the whole spectrum of narcissistic traits. So in our book, we actually talk you through some of the different subtypes of narcissism, like vulnerable narcissism, grandiose, malignant, so that you can learn what to look for in your clients and also to help your clients recognize how this may show up in their lives so that they're not falling back into those same traps over and over and over again.
Right, right. Often we hear sometimes it can look like death of a thousand cuts, and being skilled, knowledgeable, as well as really feeling confident in working with somebody who's describing things that can be confusing, needing some support and understanding. Our book really helps identify this is what you're seeing, and ask these questions and give some really clear guidance around doing your own self-exploration regarding some of the things that you're seeing, because it does get muddy, it does get confusing when you're working with this population at times.
Yeah, totally.
Another aspect that we'd like to highlight is that it really impacts so much of prolonged grief. The grieving process isn't just the first time somebody realizes that they're in an abusive relationship. It's some of the ways I mentioned before of, oh my gosh, this is how I've showed up parenting. This is how I've shown up in my work. This is how I've shown up to myself with my exercise, my eating, my spiritual connection. How the narcissistic abuse gets interwoven into our self-concept and role-based identity. So untangling that, is this me or is this the performance of a person like me? And understanding how to support clients through that grief. It's really rewarding, and it's also something that has to be discussed and nuanced as you're working with these individuals who are coming to you saying, hey, I need help with this.
Yeah, 100%. I think this work is really for the therapists who absolutely love doing deep dive work. Mm-hmm. Like, this isn't a quick one and done kind of thing. And sometimes that's really intimidating to know, like, okay, this is really deep stuff. It's really intertwined with how someone sees themselves in so many different aspects of their lives. But it's also really incredible to watch the transformation, to support clients through the transformation of seeing, like, you know, they go from, I am a good person because I take care of people, to I am a good person and I can take care of people, but also I can take care of myself. Mm-hmm. And, you know, you don't get there without going deep, but that's why we wrote this, right? Is to help you be able to do that in a way that really supports your client's growth.
Yeah. And providing some specific tools even. You know, it's the deep work, but we also do have like specific handouts in this book that we're both really proud of. Saying like,
we gave you worksheets.
Yes, we gave worksheets. So it's like there's also some concrete or some structure to it as well that I want to highlight as we're talking, because it is that dance in working with somebody that is struggling with narcissistic abuse, of being able to hold this depth and complexity while also providing structure and boundaries. So I think our book does a really nice job of that.
Yeah, we know a lot of therapists really love a good worksheet. So we created some for the therapist, some for the client, to help give you a little bit of direction in like how you might start exploring some of these things. You know, we really hope that you will integrate these into your own way of working, so that this can kind of inform, what do I need to know about this kind of client? Here are some directions I need to go. Here's one way that I could get there, and give you a really good starting point in how to do this exploration with your clients. Yeah. And I also really want to make sure that we get in the fifth really important point about this work, and what we think is super valuable, super important, is you, the actual therapist. We have devoted a sizable chunk of this book to really touching base with who you are as you're working with these wonderful clients, how you show up in the room. You know, these are your clients who have absolute, like, super fine honed radar for relationship stuff. Yeah. I'm not going to make them bleep me out today. I'm going to say stuff. I always swear on pesky things. I'm sorry. But these clients will pick it up. If you've got stuff, they will pick it up. And your stuff, whether you come from a family like the ones that you're working with in your clients, or if you come from a different set of values, like, we want you to also get some of the love and the care and the compassion that you have for your clients, because it is so important. Taking care, like understanding ourselves, having that insight and introspection, and then knowing, like, what do I do with this? Okay, so fine, I know I've got my own childhood stuff, like my inner child keeps coming up in session. We also have some guidance, some suggestions, some kind of thought-provoking reflection questions to help you do some of the exploration on your end of things, so that you're bringing your most healed, loving, compassionate, wonderful self into the room with these clients, because you all, client and therapist, like, you deserve to be in touch with those best parts of yourself.
Yeah. That is one of the things I'm most proud of when I'm flipping through the book, or seeing the reflection questions at the end of each chapter of, you know, helping, you know, grounding and understanding what we're explaining, and how you show up to what we're explaining. So it's been really that's one of the most things that I'm most proud of in the work that we've done here for you. Yeah,
I know a lot of how-to guides, or, you know, clinical books, they'll talk about, like, oh, beware of your countertransference, but they don't always go into a lot of, like, what does that look like? How might that show up? what effect does it have on the work if it shows up? So we really tried to make sure that we explore that in some depth to say, okay, if you show up in this way, like if this is how your wounded inner child shows up, how could that affect the therapeutic relationship? What's the importance of rupture and repair in this context, versus every other therapeutic context where it's important, but some places like it's even more important. Some types of client populations, it's even more important than the average. So we did write this book wanting it to be kind of a love letter to the work that we've done, and also like a really warm, supportive guide for clinicians, not just a don't do all these things wrong. It's here's some things, please don't do them because they're not helpful, but also here's your alternative. And, here are things that you might want to check in about yourself so that like you're ready to do this work and you can do it from your heart place. Because that's what it is, right? It's a loving, reparative relationship.
Right. Well said, Amy. Well said. So I think, we're really excited to just offer all of this wonderful information for you. We're here to answer questions. You can ask questions or, pick up the book. We have definitely a lot that we've covered in there, from family of origin to relationships to parenting, countertransference. I mean, it kind of runs the gamut. And then, you can always drill down and go into more detail with that too. But we are aware of how complex these individuals are, and how much it can be overwhelming as a clinician to sit with initially without having this understanding or without this kind of guidance. And so we've really, like Amy said, wanted to provide you with an opportunity to cultivate some knowledge, confidence, and understanding within yourself and within your clients that you're seeing. And it's been a real treat and a pleasure to create this work of the heart.
Yes. Oh, I love that. Work of the heart. That's so true. That's what it is.
Yeah.
We're cheesy together. We enjoy it. Okay. I'm checking the chat, and I don't know that we have specific questions here, but we can hang out for a couple more minutes. If people do have questions, I mean, we're happy to just chat about this. Oh, okay. There's one.
Great.
So we have a question: if narcissism is a valuable concept anymore, if it's trending on TikTok, it's probably more associated with blame. So I think that's a fair question. A lot of people, when something becomes TikTok popular, or before TikTok, Instagram, Facebook, we saw it where there are sort of trends in diagnosis sometimes where ADHD becomes super popular or bipolar becomes super popular. And a lot of times people don't fully understand what it is they're like claiming as a diagnosis, or don't understand what it means. Mm-hmm. I do think that narcissism is an incredibly valuable concept to understand, because if you've experienced narcissistic abuse and then you're trying to get help and people are saying, oh, it's just a social media trend, it's not a real thing, that is like the most invalidating and deeply traumatizing experience you can have. Like, it is absolutely gaslighting. And we've both had, the sad experience of encountering clients who have had that said to them by well-meaning therapists. Mm-hmm. Therapists, clinicians who thought they were reassuring a client, and in fact just like completely cut the legs out from under them by telling them that what they'd experienced wasn't real.
Yeah, and I want to add that other point too about blame. Sometimes, sometimes in our haste as clinicians, we try to get to the source, and if we go with, it sounds like you're blaming your partner or your parents as a reason why, it undermines where the person is in their process. If narcissistic abuse is happening or has happened, and they're trying to unpack their trauma. So really, I think, well-meaning, like you're saying, clinicians trying to get to, well, they're blaming their parents a lot. What's this? And maybe trying to confront that in a therapeutic way can and will do damage to individuals who are not ready to explore that aspect, because they're just trying to understand how they've been gaslit for most of their life. And so it's a great point, great question, because I do think people can go to blame very quickly. It's a great shortcut to not feel pain or amplify pain, to feel differently about something. But it's also very much going to undermine the process of therapy with a narcissistic abuse patient.
And that is also, we talk in the book about how do you work with a client who comes in the door saying, I'm pretty sure my parent is a narcissist and here's why, versus those who come in and their presenting concern seems to have nothing to do with narcissism, but you as the clinician may be able to recognize some of those subtle signs and just sort of hold in the back of your mind, I think this family dynamic might fit. I don't know if this client sees it yet, but I'm just going to kind of keep an awareness that this could be part of, what brought them in the door, and this might be something that we explore. It does not have to be a blame thing. I actually really don't like when it just goes straight to, oh, the narcissist is a jerk and an a-hole and they're just abusive and mean and horrible, because that's also somebody's loved one. Like, even if they're really mad at them, even if they're estranged from them, there is or has been love in that relationship. And I think it's disrespectful to just, come down on it as this awful thing. So we do really try, again, to recognize and address the complexity and the nuance of these relationships where, is there blame? I'd say it's more like we're assigning responsibility more appropriately, and also helping the client to own the power that they have to change what they can, which is not the person, but it is their engagement with that person.
Right. Well said. I think we have maybe one more question we could probably take with our time. And so there's a question that came through of what are the red flags that would help understand true abuse and not just the trending stuff? Do you want to start? Or?
Why don't you start that one off? Actually, I see a couple other questions coming in. So if you want to speak to that one a little bit, I'll see if we can kind of condense some of the other ones into one more question.
Yeah. So you want to look at patterns. One time argument, one time undermining, one time gaslighting is not a narcissistic abuse relationship. It's looking at patterns, how the person then responds when they confront the person with their behavior. So the client would confront a partner or their parent on, it didn't feel good when you said this, and if they double down and then push their agenda on wrongness, making the client wrong for feeling that way. Those are kind of some key tips. But I would look for more patterns, especially when the client tries to assert themselves. It's not just like the victim stance of, all of this happened to me. It's like, well, when you did try to do something, because we all do try to figure out what's happening, what happened, and then seeing if that's the same over time. So it's not a specific red flag. We could come up with a little sheet, but I feel like that kind of leans more into going away from some of the nuance. It's then because then you can go into more around what that individual, seeing the strengths of that individual, especially in that assertion, but then what they're being met with on the other side when they do assert. So I hope that answers the question that you were asking, but I would kind of lean away from specific red flags. I think that targets kind of pigeonholes things too much for the nuance of what somebody might actually be going through.
Yeah, and I'll jump on that, Ames, to also add, if someone does talk about specific things, if they say, I'm being gaslit, they said this didn't happen, I think it's okay to also sit with that and say, okay, so tell me about this experience. Has it happened before? Like Amy said, is it a pattern? We do talk a lot about looking for the patterns and cycles. What are the frequent flyers? So like Amy said, one time disagreeing, gaslighting, being selfish, that doesn't automatically make someone a narcissist. Someone might be a little higher on a spectrum of narcissistic traits and not be abusive. They might just be a bit self-absorbed. So it's not a super cut and dry answer, but if something is coming up, if a harmful behavior is happening and it's a repeated thing, it frequently happens, if it is across lots of different kinds of relationships or contexts, if it is self-serving for the narcissist, if it's like they put someone else down publicly because it makes other people laugh, and then they get to be the funny guy who, is just really good at making folks laugh and so good at roasting people, there might be some narcissistic abuse tendencies in that. But again, you really have to look at a bigger context than just specific one-off behaviors. And that's something that we kind of teach you how to do, is how to like both zoom in to specific concerning problems and zoom out to the greater context that those are happening in.
Yeah. Well said. Good job.
Thanks. I see someone noting it is important to validate the pain and experience. Absolutely.
Yeah.
And when someone is really ready to explore responsibility, then that is part of the process. And, for some clients, it's really hard to say my parents were bad or my partner was bad. They did bad things. They were abusive. And our take is really, some people don't mean to be harmful, and they still are. You don't have to say they're horrible people. It's okay to acknowledge that you have suffered as a result of their behavior. Yeah. It's not the same thing as saying you hate them.
And that is something I'll add a little bit. That's like a little bit of the learning. Like with narcissistic abuse, there's a lot of personalization that happens. And this is a way you might see clients replicating some of that learned behavior of personalizing. When I'm mad at someone, that means they're bad, or, coming up with these kind of black and white concepts and polarizing individuals inside, rather than being able to hold both realities of, I can be really upset about it, and they're also not the worst person on the earth. So that's some of the work for our clients too, is pulling out these ways in which they are replicating these learned behaviors, for sure.
Yeah.
And that's where you'll see some growth. Like it's really fun to see that growth.
Yes. I want to just acknowledge there's a question up here, a two-parter that I think is important from Gabrielle. I'm going to answer the second part first. What are good somatic therapy options that work well for recovering from narcissistic abuse? Amy and I both have a little bit of crossover and a little bit of differentiation in what we like, but I'd say we both really prioritize anything that is very holistic, that incorporates mind and body together. So for some, EMDR can be absolutely wonderful. For some, the sort of like stepchild of EMDR, which is brain spotting, can be amazing. I personally love brain spotting, but I've also seen a lot of clients who really respond well to the EMDR. Janina Fisher does a lot of work with somatic experiencing for complex trauma. And I don't want to like misquote her off the top of my head, but I'll say she's also a great resource to look into. And Amy, I think, has also done Hakomi training, which is very holistic and mind body.
Yeah, right? It's again a very different approach. It's not for everyone, but it is can go very deep, very very healing. So that's another approach in addition to the ones Amy mentioned. I'm sure there's others. These are the ones that we've been trained or at least dabbled in or worked with people or in that context. But yeah, I think that's kind of the aspects of somatic work that we've used, that we've enjoyed.
Yeah. Parts work is also really wonderful with these clients and can help with, there was a question earlier about sort of teasing apart learned behaviors from what is sometimes in the narcissistic abuse community called fleas, which is learned behaviors from being in a long-term relationship or a family relationship with a narcissistic person. You may end up sort of taking on or replicating some of those traits and behaviors. So parts work can also be a great way of looking at, I've got a part that never wants to do the things that my parents did with my children, and I've got another part that just wants to scream at my kid when they do something frustrating, and then I feel like a bad parent. And you can, explore all of those different levels of what comes up for a client around a specific trigger.
Yeah.
All right, Amy, do you want to tackle the first half of that question?
I'm trying
to say something about that? What do you look for when searching for an appropriate therapist for healing from narcissistic abuse?
That's a great question. I think for me, it's always relationally. So I think it's something over time. So when you're saying you search for someone, it's going to be first, I think, an initial feel. Does this person have training in trauma, complex trauma? Do they understand interpersonal relationships, interpersonal and inner, your interpersonal relationship with yourself, and how those two can interplay together and influence each other? But I think over time, it's like, does this person get what I'm saying? Does this person, am I trying to teach them more than, as a client, am I trying to teach them more than what they know? And seeing if that is a good fit that way. If somebody's willing to learn or explore more, that might be an option. If there's nobody in your area that says they specialize in this or has complex trauma. But those were kind of the key words I would look for is trauma, complex trauma, somebody that can probably do some level of somatic work as well to bring in the body aspect of what they're holding, as well as interpersonal and interrelational challenges. So it's pretty complex. That's why it's not easy. I think fit is just, it's important as in any relationship, kind of like dating. Like, is this going to work? Is it not?
Yeah, do they pass the vibe check is a really important, really important first step, because to become vulnerable with someone and share things like, I don't know if I can trust my take on reality because I've been told I'm wrong so many times. And then for someone to be like, well, I mean, what if you are wrong? Like, you could be crazy. Maybe your parents aren't that bad. Maybe your whoever isn't that bad. Or maybe you just need to like behavior your way out of it. Right. To take an overly simple or non-supportive, not understanding the context approach can do a lot of harm, even when people do mean well.
Right.
Intent does not negate impact.
Right. That's right. Well, we are about out of time for today. I really appreciate, I know there's more questions and comments, and it's really heartwarming to see that and the interest, and because this is, Amy and I just love this work. It's a passion. So seeing that is wonderful. And we appreciate so much for you all asking your questions, comments, attending, spending your lunchtime with us or early or brunch time with us. And I hope you enjoy our book. If, reach out if you need any additional resources. Thank you so much.
Yes, thank you so much for your time and your attention. You have great questions. Yeah. Pessy has lots of other wonderful resources, including other books and trainings. I think our book is, the bee's knees, so I hope that you will pick it up because I think it's a really good work, and I'm very proud of us for putting it out there. And, Amy and I also have both spoken with Pessy, and I provide consultation for clinicians. Amy, I think, also does some consultation. So, please don't hesitate to deepen your learning on this. And, I hope that we will hear from or see you again in future trainings.
Yeah. Thank you.